Hi, this is
Hello.
uh, today I wanting to speak with Dr. Kim Evett. She is a occupational therapist with the Early Childhood Intervention Program in Belton, Texas. And she's going to explain a little bit about where she works and what she does in the ECI program. So, Dr. Evett, tell us a little bit about yourself.
Well, I've been in OT for quite a while, since the 90s. And I started off actually in inpatient rehab and kind of got my hospital type skills. And then I had a friend who kind of got me into outpatient pediatrics. And from then I did some in the school system. And while I was living in Houston at the time, and I got, oddly enough, a cold call from um, one of the ECI programs within Harris County, and I didn't know much about it. And when I went in and talked with the people, and they told me what they do, I was like, I need to do this. And so I have been doing this ECI within Harris County, Bexar County, and San Antonio, as well as here in Central Texas, where I'm at now.
Awesome. Okay. So tell us a little bit about the OT process and how that works in ECI.
Well, ECI is made up of a group of professionals, and essentially it's home health, but it's geared to the 0 to 3 population, meaning birth to 3, some people will call it. And OT is one of several types of providers that children may get. We also have physical therapists, we have speech therapists, we have early intervention specialists. Some programs have nurses, some programs have ABA specialists. Um, it kind of depends on what kind of, I guess, skill set is within that county range. But if all of those professionals are kind of geared with the same focus, in that the earlier you start intervening for a child, the better the outcome. So if we can get with the parents and help create routines that promote development and promote a healthy learning environment, that helps prepare them for when they are in preschool, as well as later on in school in the rest of their life.
So as far as the process goes, you start with the referrals and go straight
Oh,
through the whole
mhm,
process to
right,
discharge, right?
right. Um, so the referral process, anyone can refer for an OT, or I'm sorry, for an ECI assessment, which is maybe a little bit different from the outpatient setting or the school setting. Some of the, obviously, hospital setting is a little bit different. So we outreach to a lot of different daycares, physicians, and to like WIC, women, infants, and children. And all of those kind of, especially their service coordinators, know that when they see a child that the parent might have some questions about their development, they will call ECI. And the process is, we have an intake coordinator who will call the family and kind of ask what their concerns are. Sometimes, if it's a week or two in between when they refer and when they call, sometimes the issue has resolved, or the parents um, have kind of figured out maybe that's normal or not. And once the intake occurs, if they still figure out that there is a need for an assessment, the intake coordinator figures out if, well, is it a speech concern? Is it a motor concern? And that way they can have the right team members on board for the assessment, and the assessment is set up. So, um,
So does that assessment happen with everybody at one time? Is everybody there together?
well, it's a team of two, and it is generally a service coordinator And that is someone who has a background with children as well. And generally it's someone with a bachelor's degree, or it could also be someone with a degree in social work. We do have some that have masters in either child development or social work. And then it would also be a LPHA, which just means licensed professional of the healing arts, which is kind of a weird acronym, but that's what we use in ECI. So depending on what the child's needs are, there's a team of 2 of us that will perform an evaluation that gives us some feedback on whether or not the child is performing at their age level. And of course, if they were preterm, then we adjust for their adjusted age or the corrected age. So if they're performing to their adjusted age or their chronological age, whichever is appropriate, then they won't need services. But if they do meet the criteria, then we will kind of make an IFSP plan, which is the individual family service plan. And as a team, and that the team includes the parent, so we will decide what services are appropriate for the child.
So, so we talked about the qualifications and a little bit about the different people on the team and the team roles. It sounds like OT may play a little bit of a kind of a case manager role in a way, or maybe a gatekeeper role. Is that to help determine if the child needs therapy or needs ECI? Is that what I'm hearing?
Well, actually, for the state of Texas, and I think most states, they have a minimum qualification. Historically, it had not been that way, but over the years, and kind of when you follow the IDEA Act and some of the other legislation that provided for services in preschool, what they have now is that a child has to meet qualifications by being 25% delayed in any one area, or a 33% delay if we're talking about expressive communication. So when I was talking about the evaluation, the 5 areas that we're looking at are adaptive skills or self-care skills, looking at fine motor skills, gross motor skills, personal social skills, and cognitive skills. So that's why it kind of takes 2 people to look at all 5 areas, and any one of those areas could be delayed, and that would qualify for the child for services.
And I know there's certain evaluation forms that you use and that you do in that setting that goes over those specific areas of concern. And are those really the only areas that are evaluated for that, or is that the only areas that OT evaluates?
Well, the state, for qualifications, they want a comprehensive evaluation of the child. For instance, if a parent has concerns about development of motor skills, maybe they aren't aware that that's also maybe the cognitive skills are affecting their motor performance, or maybe their cognitive skills are affecting their self-care skills. So we want to look at the child as a whole. However, when it comes to the actual goals, for instance, I might have goals that are more geared toward fine motor and gross motor, as well as self-care skills. But that's not to say that when I'm working with a child, because all of the team members have a broad expertise in 0 to 3 development. So when I'm working with a child, there are certainly times that if I know that the child has speech issues, I'm going to maybe, if I know that they're also working on sign language, some of the easy signs, the more they eat, things like that, I'm going to incorporate that into my session as well. So that's how we all overlap and kind of work.
So would you say that that's a transdisciplinary approach there?
Absolutely.
more
Yes.
so than a multidisciplinary or interdisciplinary. It's really going into transdisciplinary.
Yeah, I would say so, because there are times that, for instance, a child could have a delay in fine or gross motor skills, and let's say I don't see um, tone issues. The child hasn't had a hospital stay. Maybe they aren't a preterm. Maybe it's a lack of opportunity, in which case we might put on the IFSP plan that the goals are going to be carried out by the specialized skills trainer versus an OT. We have to kind of determine if is it something that a licensed therapist needs to address versus someone who just knows a lot about child development.
Ah, that's very good. That's a good point. So, kind of a thing that I was talking to students about is that that clinical reasoning part. You
Exactly.
know, when you get that referral, you have to determine, is this real? Is this, am I the one that needs to help this child? Who is the one that really is the best person to treat the child? And know who else would be the one to do it. So that is a good example of uh,
Right.
the least, the the least, what do they call it? Um, the least restrictive environment
Right.
type thing.
Well, initially, someone who does the intake kind of decides if a motor person needs to be on the team to evaluate, or a speech person. But after that, once like I'm on board, then I can look at the child and make a determination, a clinical reasoning determination. Is this something that they need my specialized skills for as an OT, or is it something that the specialized skills trainer or early intervention specialist can assist the parent with? Maybe it's just that they need um, ideas on setting up the environment and giving opportunities. So in that
Yeah,
case, maybe they don't need us. But if it's something that is like a lot of hands-on skills and um, maybe a lot of parent coaching, then definitely that would be something I would take the case for.
awesome. Okay, so as far as communication goes, do you guys ever have codas that work under you? Are there ever any codas in ECI?
There are, but not in my specific program. Um, there have been PTAs that have worked in the program, and one of the, I guess, the harder things a few years ago is hard to find a PT just in our area. And so if we don't have a PT, we cannot have a PTA because obviously they have to be
Supervised?
supervised by the
Yeah.
PT. Right now, we don't have any codas, and um, part of that is like I'm continuously, once a child meets a goal, then I can easily up the goal to something else. Whereas if we had a coda, then they would have to kind of check in with us, and it wouldn't be a problem. It's just just an extra step. So
So, and it's kind of like, due to the level of care, or like the treatment timing, like you might only see them once a month or once a week, or what is the scheduling? I mean, that would be hard to supervise a coda that way, because you're gonna have to see the coda, or at least supervise the coda once a month too, I think. So it would almost be that it wouldn't be quite as efficient, I guess would be the word.
right. And efficiency, because we see all of the children in the home and setting, or there are some that we will see in the daycare setting. And the idea is that we want to see the child in the setting that they're going to be in, because generally it's deemed like the 0 to 3 population. Um, they, as far as transfer of skills, if you work on that skill in the home setting where they're going to be doing it, that is going to produce better outcomes than the clinical setting, is the thought process behind ECI. So that's why it is done in the home environment. Or if the child is in daycare every day, um, we would coach the daycare teachers on different ways that they could assist the child, so that so that there's therapy, in a sense, that those opportunities for learning go on every day versus like 30 minutes twice a week, like in an outpatient setting. So.
I know we're kind of going on here, but I do want to talk a little bit about just what it's like to be an ECI therapist, and what is your day, what's your day like, and what would these guys want, or what could you tell these students that might be interested in going into ECI? How would what are some things that you might want them to know?
Well, like I said earlier, it is all done in the home. That doesn't mean that I don't talk to other people on the team, which I do, because they're just a phone call away. But generally, there is not another service provider in the home at the same time as I am. So we do communicate by text, phone. We do Teams calls and things like that to help communicate to each other how the child is progressing. I have, let's see, I'm not working full time, but I do about half time. So I have worked full time before. Generally, it's about 4 to 5 kids that I would see a day, and they generally want you to do probably about 80% productivity, meaning that 80% of the time is with the child or in a home. But they also take considerations that you are traveling in between homes. So that is also considered kind of time that is spent. And especially when our program has 5 counties, there are quite a few miles that I put
That's a
on
long a
in
lot of
my own
driving.
car. And ECI programs, as far as I know, I haven't ever worked for a program where they've had their own, like an ECI vehicle. It is all the therapist using their own vehicle, but the state pays a reimbursement rate for mileage. So that is one thing that for those of you who might not like driving, that might not be kind of your best place to go, like as a new grad, or I guess if you're not one to, if you easily fall asleep driving, then yeah, this
Don't
probably
do it.
wouldn't be the job for you. But I find it actually kind of relaxing to drive in the areas that I drive. There's a lot of rural areas that I serve, but if that wasn't what you wanted to do, they could place you in zip codes that have a more urban area where you weren't driving quite as much.
Mhm. My question just flew right in one ear and out the other. That's not a good thing.
Well, I know I probably need to tell them within ECI versus private, some of the differences is that private therapy, sometimes they'll see a child 2 times a week for 30 minutes. Because our goal is to work and coach the parent, we generally would only see a child at the maximum 4 times a month. There's some kids that I see twice a month. There's some kids that I see once a month. And the idea is that I'm trying to figure out how much support does the parent need to follow through with all the suggestions that I give them, meaning that when I'm working with a child, I'm going to show them, hey, here's how you can help your child maintain a quadruped position, or here's how you can help your child work with a fork or a spoon to feed themselves. So it's generally how much support does the family need, and some of it is based on the child as well. If there's a child with a lot of medical needs, very low tone, that child I would probably see more often than someone who is maybe just a little bit less behind.
So that is reimbursed by the state, right? Are those children are paid? Are you those services are paid for by the state, or they're not private insurance, correct?
Actually, kind of over the years, because ECI is now like 35 years old, I believe. It started out as it was free to everyone, and the state reimbursed the ECI programs. However, because there was so much need for it, where we are now is that there is a family cost share, meaning that the state will bill Medicaid or your private insurance. However, if there is not any reimbursement, like for some families that don't have insurance, they'll use a sliding scale fee, meaning that they'll will take down the information as far as like how much the family makes and the co-payments per month, no matter how many services you have. You could have like 3 services, and say like, gee, 12 visits a month. It would be the same rate per month as someone who only got 1 service. So what I've typically seen is anywhere from $5 a month to $20 or $25 a month. So that is way less expensive than if you went to a private outpatient
Outpatient.
clinic and had to pay those co-pays every time.
Right. And so you're being paid by the state, so you're considered a state worker? Is that true?
Well, our ECI is through an MHMR company, and every ECI has a different umbrella organization. A lot of them are under the MHMR, which is mental health and mental retardation. However, they're getting away, obviously, because of the nomenclature, from that type of label. But there's private nonprofits as well as school districts. The first ECI I worked for was a school district. So, for instance, the entity bills the insurance and also collects money from the state, and that helps with the provision of services, as well as, for instance, the overhead for like the managers and I guess the building costs.
I was just thinking of the state benefits. I didn't know if you could receive state benefits because you worked for ECI.
No, that's a little bit different. We receive like the local benefits from our agency.
Okay.
Mhm.
Okay, cool. So as far as a new grad, do you have any idea what kind of a starting salary might be for them? Or do you get paid by the hour, by the visit? How does that work?
Well, if you're a PRN employee, or a half-time employee, it would be a hourly rate, but for the full-time employees, it's salaried. And I would say um, it could vary anywhere from, say, 70,000 to maybe
85.
80, 85. But it all depends. Actually, there are some agencies who will pay more. Some of the rural places will not pay as well as the urban places. And when I say urban, I mean places like Harris County, San Antonio area, probably Tarrant County, those up in Dallas. So those generally, it depends on where you're at.
Okay. Thank you so much. Is there any words of wisdom you have to share with the students that will be listening? I don't think I really introduced you to them, but they are beginning their second year of OT school. So this is their first round with pediatrics. Some have seen some a little bit here and there, but this is their first semester for pediatrics, hard and heavy. And their first semester to be taught by me. So aren't they lucky?
Yeah.
But anyway, so they're in for a real treat. I know. So I want to see if there was anything you wanted to say to them, or, whatever, however you want to, whatever you want to give them.
Well, kind of like in my own journey as an OT, I did not go directly into pediatrics. I felt like I wanted to get generalized skills. So that's why I did inpatient rehab. I really wanted to get some hospital skills and kind of get that on my resume. Now, it's not to say that you couldn't do ECI as a new grad, but just know that you're seeing children on your own in a home, and you'll have plenty of support. It's just not another OT kind of in the room with you, like, or in the gym with you, as it would be in the hospital setting. And I know of some people who have gone straight from a new grad setting, but I think a lot of it has to do with if you have happened to get a field work in an ECI setting, that's a much easier transition than, for instance, if you were going from an adult setting and then you went straight into pediatric ECI. I think that would be a lot more difficult to do.
And that's definitely something, I don't know if they've been assigned to their level 2s yet, but that may be something for some of them to think about, because I know there are ECI fieldworks out there. So thank you again for visiting with us and teaching us all about ECI today, and we appreciate it. And maybe we'll get to see you again soon.
Yep.
Thank you.
I'm here if anybody has any questions.
Oh, and I will give them your email address. You said that you wouldn't mind if they had any questions if they emailed you.
Absolutely.
Awesome. Okay. Thank you much.